My name is Seshadri Raju. I was born in South India in Trichy, and I've been in the United States for the past 51 years. I live in Jackson, Mississippi, and my practice is there as well. I'm originally a cardiothoracic surgeon, but gradually narrowing my interests, and for the past 20 years or so, actually 30 years, I've been specializing in venous disease, and it is an exclusive practice. I have connections to the Venous Association of India, and I have been invited to be at that conference several times. I think this may be the fifth or sixth time I'm coming here for the conference to participate. The conference is a remarkable one. The board of directors and the leadership is highly competent and well versed in venous disease, and one is impressed how the scientific standards here displayed in the conference is on a par with world-class practice standards that one can encounter. Venous disease is a very common disease. Most people do not realize that venous disease is 3 to 4 times more common than arterial disease. However, venous disease is often not life-threatening or limb-threatening, especially when there is no blood clot involved or non-thrombotic disease. It's basically a quality of life issue. Even though it's a benign disease, the quality of life can be miserable with it. Unfortunately, the treatment for it for decades, even though disease has been known since 1970s, adequate treatment was not available, and the techniques that were available, like valve reconstruction, were very difficult. In the last 20 years or so, stents, venous stents, have become prominent. I think stents are commonly placed in coronary arteries and for arterial disease. Now stents are being used on the veins as well. It is a much simpler way of treating advanced venous disease than previous techniques, so it offers greater access. Because it is more accessible and is used more often than before to treat venous disease, interest on the whole subject of advanced venous disease, including diagnostics and techniques, have become more important, and the venous conference like this one is the proper forum to discuss those aspects of venous disease, in addition to techniques of stenting and the results and so on. So in closing, venous disease has come of age as its own specialty, and this conference has grown year by year, and I am sure will continue to grow in the future. Thank you.